A husband and wife walked into my clinic. You could almost feel the tension between them. A tension so thick it filled the room before a single word was spoken. In the man's hand was a pelvic ultrasound scan report. He passed it to me without saying a word. The conclusion on the report was pelvic inflammatory disease. Within seconds, accusations started flying. Doctor, the man said, I read that pelvic inflammatory disease is caused by a sexually transmitted infection. I have been faithful. So how did she get this? What happened next is a lesson every couple and honestly every human being needs to hear. Today, we are diving into one of the most misunderstood diagnoses in medicine and how getting it wrong can destroy trust, health, and even lives. Before we go any further, let's be clear about what pelvic inflammatory disease or PID actually is. It is an infection that affects a woman's reproductive organs, which are the uterus, the fallopian tubes, and ovaries. Here's a simple way to picture it. Imagine your reproductive system as a beautiful, well-tended garden. Normally, it is protected, but when harmful bacteria sneak in, usually through the vagina, they climb upwards and cause inflammation. If left untreated, that inflammation can scar and block the fallopian tubes, leading to some serious problems like infertility and chronic pain. So, how does PID actually happen? It's true, the most common cause of PID is sexually transmitted infections. Infections like chlamydia or gonorrhea. But here's what most people don't realize. That's not the only way. PID can also develop after childbirth, after a miscarriage, following abortion procedures, or even from inserting an intrauterine device which we use for birth control called an IUD. And listen to this, even douching, which many women do for hygiene, can push bacteria higher into the reproductive tract and trigger PID. So let's be clear, a diagnosis of PID does not automatically mean there was unfaithfulness. Jumping to that conclusion can cause enormous damage to relationships, trust, and healing. Now, when I carefully reviewed the ultrasound report the man handed over to me, something immediately stood out. The sonographer who did the scan had based his diagnosis of PID almost entirely on the finding of free fluid in the pouch of Douglas, also known as the POD. Now, let's talk about what that actually means. The pouch of Douglas is a small natural space behind the uterus. Finding a small amount of free fluid there is very, very common, especially around ovulation, after menstruation, or even after mild inflammation that has nothing whatsoever to do with infection. So, while free fluid can sometimes be one of the signs of PID, it is not enough by itself to make a confident diagnosis. It would be like hearing just one note and trying to guess an entire song. You simply don't have the full picture. Now, speaking from experience, I've been performing pelvic ultrasound scans for over 10 years. And in that time period, I have seen countless women with free fluid in their pouch of Douglas who were completely healthy. That's why when it comes to diagnosing PID, we rely on much more. Clinical symptoms, vaginal swabs, blood tests, and a complete clinical evaluation, not just an isolated scan finding. In the case of the couple sitting in my office, I calmly explained everything we've discussed. That free fluid alone is not enough to diagnose PID. That clinical symptoms, lab testing, and a complete medical evaluation are needed before anyone can draw that kind of conclusion. So we decided to dig deeper. We ordered a full panel of tests for the lady, including vaginal swabs and blood work. And we also did another ultrasound scan. This time I did it personally, under my guidance. the new scan showed only a small amount of free fluid with no thickened fallopian tubes, no tubo-ovarian abscess, and no signs of pelvic abscess or severe inflammation. In other words, there was no evidence of active PID on the imaging either. Now, combined with her normal test results and lack of severe symptoms, we concluded that the free fluid was likely a normal physiological finding, not a sign of infection or betrayal. Now, slowly the anger and suspicion I first saw on the husband's face began to soften. Confusion turned into understanding. Fear melted into relief, and through honest communication and complete medical evaluation, trust was slowly rebuilt. Health misunderstandings can destroy trust. Relationships are fragile. That's why before we jump into any conclusions, we must seek understanding, not accusation. Pelvic inflammatory disease is real and sometimes very serious, but diagnosing it correctly requires the right tests. It requires the right expertise and above all, the right mindset. If you learned something new today, or if you've ever faced a health misunderstanding that challenged your trust, I would love to hear from you, and I would love you to share your story in the comments below. Let's learn together, let's heal together, and of course, if you found this video helpful, please like, subscribe, and share it with someone who might need it today. Remember, communication plus science equals healing.